Welcome, everybody. How's it going? My name is Emma Boland, and today I'll be presenting to you on the complex ethical and legal scenario which we discussed that involves a patient with severe brain injury who doesn't yet meet Arizona's legal definitions of brain death. This case, we will explore how healthcare administrators, in the role that we may possess one day, will apply ethical reasoning, the state laws, and hospital policies to help resolve family conflicts and ensure the appropriate care in this kind of scenario. To overview the case, we have a middle-aged patient, about 45 years old, who is now located in the intensive care unit who's following a traumatic brain injury. While their neurological function is severely compromised, they technically are not legally brain dead. The family members are having conflict in this scenario. Some of them believe that the patient wouldn't want to live life on support, while others accuse them of trying to end the patient's life prematurely for financial gain, such as life insurance. The staff is, of course, experiencing distress, making it crucial for our hospital leadership to intervene ethically and legally. All right, the medical care issues. From a clinical standpoint, our patient's care has to continue because they're not legally dead. This presents challenges for not only our ICU team, who may feel conflicted providing care that seemed as futile, but also, of course, the family. But going back to the staff, the clear interdisciplinary communication and involvement of palliative care specialists will help align expectations for this patient's care. Additionally, if we ensure psychological support for our staff, especially in a time like this, it's critical for burnout prevention and preventing compassion fatigue, which is when providers start to feel a lack of compassion for their patients or people they're dealing with. So that's kind of the communication breakdown and our staff experiencing moral distress. Now, we see the Arizona law definition of death. So that will play into part of the care of this patient because under Arizona law, a patient must meet one of the two criteria to be declared dead. Because of this patient retaining some brain activity, they don't meet the statutory requirements for brain death. Legally, they must be treated as alive. Removing life support at this stage could expose the hospital and providers to liability and violate both state and federal rights protections. As administrators, we have to ensure that medical and legal standards are being consistently upheld. We talk about the Arizona statute and the two kinds of determinations of death, neither of which our patient meets and has not been confirmed. Now, what are the legal implications of this scenario? Legally, our hospital must ensure no action will contradict state death determination law. Even if the prognosis is poor and our staff is wondering if it's futile care, discontinuing the life support without proper legal or clinical justification could be considered negligence or criminal, implicating staff, administration, etc. We must review whether the patient has an advance directive or durable power of attorney. If not, the decision must be deferred until the consensus is reached with a court intervention occurs. We don't want to risk disciplinary action for premature withdrawal, and we will be documenting all decisions and actions in this scenario because the top advice of legal situations is document, document, document. Now, the ethical principles involved in this situation. The four from the foundation of our decision making are discussing autonomy, beneficence, non-malfeasance, and justice. Since the patient cannot express their autonomy, we rely on their prior statements or their family's accounts to infer their wishes. The beneficence and non-malfeasance refer to continuing treatment until the medical and legal criteria for death are met. but also ensuring that the patient doesn't endure unnecessary suffering, whether they can confess it or not. Justice demands impartiality on our end. We must avoid letting family disputes, money, or even our personal beliefs dictate this person's medical care. Now, navigating family conflict dynamics can be difficult. They can quickly escalate and compromise the therapeutic environment. It's important for administrators to maintain a neutrality when people are divided between continuing and ending life support. How and handling accusations of financial motives for inheritance. It's important that administrators prevent hostility from affecting the patient's care, first and foremost, and an ethics consultation can serve these people as a structured forum to mediate disputes. We can clarify medical facts and focus on the patient's best interests rather than the emotional or financial considerations. Now, the role of us, the hospital administrator. We are there to ultimately ensure compliance with the law and policy. We facilitate communication between everyone. My role is not to make a clinical judgment, but to ensure the environment is conducive to ethical and lawful decision making. We include verifying documentation, medical opinions, and that our communications comply with hospital protocols and state law. It also involves protecting our staff and our staff morale and ensuring the hospital is a place of compassion and professionalism throughout all the tension and difficult decision making. Administrators are the number one support of family and staff and the law at the end of the day. Relevant policies and procedures. So now we'll go into the relevancy of these things. We have the end of a life and brain death verification policy, ethics committee consultation policy, family communication and conflict resolution policy, and advanced directives and patient rights policy. These policies provide institutional framework for consistent practice. They define who determines brain death, how disagreements are mediated, and how staff should respond to ethical conflicts. The administrator must verify these procedures are followed, we document them, and we review them for both the family and care team to maintain our transparency and compliance. Now, ensuring ethical integrity. Should I take a sip of water? Our ethical integrity is ensuring that every decision is evidence-based, transparent, and we can defend it. We should require multiple physicians to confirm brain death. That way it's less of a debate and not one person's fault in the confusion. We should have them it ensures accountability. Our ethical practice also involves communication. Having a committee and legal counsel before decisions will help regularly update family and give them compassion and honesty even when the prognosis is grim. We have to, a good idea, not have to, but a great idea is to include a chaplain or spiritual care and social services when it's necessary to help the family cope and provide emotional support. We can also offer similar services to our staff in times of their grieving when prognosis is grim, and they suffer loss as well in these hard scenarios. Now, how can we do implementation of these things and monitoring? Implementation of procedures that protect both the patient and the organization. We can review medical documentation for updates. We can communicate with risk management, document all family meetings and discussions, debrief, that we can at least, debrief staff to reduce moral distress, and always be prepared for potential legal or media inquiries. Continuous monitoring ensures that we're not violating law or policy in any of these places. The documentation and staff debrief will help clear up misunderstandings and continue supporting the transparency we've discussed throughout the scenario. And in this day and age, the preparation for possible media involvement helps maintain our hospital's reputation and also helps ensure our accountability. Some resources for support. These are resources providing both legal and ethical decision making. We have our hospital ethics committee and legal counsel. These help balance competing values and ensure compliance with the law. Our external references, such as the AMA, American Medical Association, and the ADHS, Arizona Department of Health Services, and the AHA, will all serve as the guidelines to provide national standards. And then the chaplain, social work, palliative care supports the emotional and spiritual needs of everyone involved, as we previously discussed. In conclusion of this scenario, we see in this scenario the underscore of the balance between the law, ethics, and our compassion. As administrators, we must uphold the state's definition of death. We have to support our clinical teams and guide the families through some of the most painful moments up to this point in their lives, most likely. Doing this with integrity ensures our hospital remains a place of trust, empathy, and professionalism. And we continue to lead the helm as administrators. Thank you. Here are my references. Thanks.